Thank you, everyone. Good afternoon. It's a great pleasure to be here. I want to acknowledge the Silvera guests as well. Thank you for coming out and showing your support. Bruce, thank you for the introduction, and I want to thank you and all that the Rotarians do day in, day out to create a better city for all of us. It's big work. You've certainly been at it for an awful long time. Building a better city and supporting vulnerable Calgarians has been the work of the Rotary for 100 years. Not very many organizations can say that. And I want to congratulate you on that milestone and leaving a legacy of community involvement and community care. That's why I'm pleased to be here today. It's a pleasure to share with you and shed light on what I believe is a key population in our community, and that is the state of seniors in Calgary. Above the 25 years in the not-for-profit sector and my passion for this sector, I am first and foremost a daughter. I have a 93-year-old parent, and he has to navigate the health system and the housing system, sometimes for the better and sometimes for the worse. I take care of his care support needs. I make sure that he gets out and is living a full and an engaged and active life. I advocate for his safety. I make sure that he is living a life with meaning, and I pray for his happiness. That's where the head meets the heart. Seniors care is more than a job for me. It's personal. When I look out at all of you, I think it's personal too. First of all, we're all here, which means we're all aging, hopefully for some time. But beyond that, it's movers and shakers like you who started Silvera in the first place. In the late 1950s, a prominent group of Calgarians, like yourselves, came together to create affordable housing for low-income seniors. Those very leaders built Bow Valley Lodge in the Bridgeland area, and we still use that facility today. I'd venture to guess those same leaders started the appeal for affordable housing by asking other Calgarians to join in. And I'm going to trust that those conversations, some of them happened in this very room with groups like yours. For many years, Metropolitan Calgary Foundation was our banner, or MCF Housing for Seniors. But then in 2012, we turned 50. And we needed to know that we could do this for the next 50 years, and the next 50 years was going to be different. And that we needed a name that reflected who we are and who we serve. So we changed our name to the Silver Era, Silvera. Today, we have 26 communities across Calgary serving 1,500 seniors. That doesn't even speak to the waiting list that we serve. Our housing levels are independent living, straight through to supported living environments where we provide 3 meals a day, basic housekeeping, basic activities, and 24-hour staff throughout the day. Our mandate hasn't changed over the years. Serving low-income seniors is at the core of what we do. We still need to provide services for seniors and make sure that there's affordable housing. And in fact, the demand is growing because we're aging. The population is skyrocketing. I hope I'm not alone in saying that what we're doing today is not enough. It's simply not good enough. You just have to look at the headlines. With unprecedented and well-warranted scrutiny, how seniors are treated in care facilities. Hardly a day goes by where there isn't an incident, where we're not in the papers, that there's an article being written, a letter to the editor, and God forbid, a tragedy. The news is casting the spotlight on what this stage of life can look like. It's not a pretty image. It's not easy to be a senior. Trust me, I'm told that weekly. In my role in leading an organization that provides housing and services for low-income seniors, and in my role as a daughter of a much-loved father who is living in one, I can tell you that I feel the public and the private pressure, the expectation, the demand that we do better by our older Calgarians. I'm very concerned. How am I, hopefully, how are we going to do this work? How are we going to make it happen? Here's a snapshot of some of the issues. The average age of our residents is 86. We have 100 birthdays all the time in our organization. They come with very complex needs. They are living longer. It's becoming more and more difficult to service their needs. The time to act is now. In the next 17 years, how old will you be? 1 in 5 Calgarians will be a senior. Hopefully you age well. Low-income seniors are being left behind, many prematurely living in hospitals, calling a hospital home because of the lack of affordable housing and because of the lack of home supports. Yet, here we are, seniors do not make appealing or trendy subjects for charitable giving. I asked you if you all pulled out a $20 bill right now, and you tore off the portion of your $20 bill that you either have or will make to a senior's issue, I bet you I wouldn't hear that tear. Wouldn't be a big tear. You could hear a pin drop. People want their money, their donations, to go to important causes. But what's the explanation as to why almost 0 donations go to seniors' initiatives in our city? Are they not worthy? The historic flooding in Calgary is still deeply imprinted in our minds. It affected many. The news coverage was huge. It was in every one of our conversations. There's a lot of need and a lot of urgency and a real cry for people to give. Calgary saw an outpouring of donations. Couldn't give enough. For Silvera, we had to evacuate 600 seniors from 5 facilities in Bridgeland. In the middle of the night, it was an overwhelming task. It had a tremendous financial impact. Our staff had to do the monumental work of moving a fragile population in the middle of the night, both quickly and safely. And although we had lots of media coverage about the challenge for seniors to move, the donations didn't come in. We received a total of $1,000 in donations, and one of those donors lives in Ontario. I don't think that Calgarians don't care. I don't think that. I believe we don't think of seniors, period. As a society, we certainly don't think of seniors as a cause. Perhaps we don't realize that many are vulnerable, and many are alone, and many are on low income. The flood emphasized this need for Silvera. Many residents have no one for support. We evacuated those up to COP in the middle of the night. Residents we knew wouldn't be able to lay on the floor for hours, let alone days. We knew we needed to get activated the home care supports that we needed. We needed to get oxygen tanks. We needed to get meds delivered. We needed to get incontinence products delivered. We needed to get to a hotel. So off we went. But even in hotels, after just a few days, the residents were failing. That's not the environment that they can live in for any length of time. For you and I, it might have been a weekend away and quite enjoyable. But seniors can't get up on those beds. They can't get into the showers. Those who had family or friends that were able to take them into their homes, very quickly they started calling us saying, "When are you going to reopen? I can't manage them. When can we bring them back?" Some seniors were returned unbathed, unchanged, not having taken their medications consistently, It was a clear demonstration for the need for appropriate housing and appropriate supports, like those that we provide at Silvera. Still, society continues to put seniors and their needs on the back burner, like time isn't of the essence. Staring at us is a huge cliff. Look around the room. Most of our efforts, most of our care, most of our concern, most of our funding goes to the up-and-coming generations. Maybe we assume seniors are all off golfing, doing just fine on a pension, made hay here in Calgary in the oil and patch. Or they're living the Freedom 55, but not really low-income seniors. You're not going to see them on the golf course. In affordable housing, they're out of sight, out of mind. You don't get to see a glimpse of what the future could look like. Seniors who have the money and can afford to pay for private housing will go there. Lots of amenities, lots of services, some luxury. But those who can't need Silvera. The cost of private is way beyond the reach for low-income seniors. You can take a look at the monthly costs. I don't know very many people, and certainly not those that we serve, that can afford somewhere between $4,000 and $8,000 a month. How and when will we be motivated to make sure seniors aren't falling through the cracks? Can we get on it? Can we do it now? I can tell you at the holiday times in senior centers, they're pretty deserted. There are few visitors. Many of us the seniors have outlived their loved ones. You know, if you're 100, your child might be 70 and living in a community. Or you hear the conversations all the time when you talk to elderly people that everyone they know is dead. They go to more funerals than weddings. Sadly, some people don't have nice family. As much as we try to make our facilities homey, nothing can replace the love of family and friends, but more so the connection to the broader community. That's where Silvera comes in. We'd like to be an advocate for change. We'd like to put seniors' issues front and center. As a society, as a great city that Calgary is, we recognize the benefits of diverse communities, incorporating varying income levels, communities that have different genders, communities that are built, that ethnic backgrounds are throughout the community. What we're not recognizing, and we need to recognize, is that we hope that that will include the integration of ages, that seniors aren't behind the walls, locked up and out of the way. Silvera's part in that is not only to provide a high quality care in our own facilities, but also to build communities that are vibrant and integrated. We need your support for services today. We need to ensure seniors live with dignity and live with meaning. The future, we know we need to build seniors housing that will integrate. That's why we're pleased to be participating in the Resolve Collaborative Capital Campaign, one of 9 agencies under Resolve. The campaign has the potential to be the first capital campaign in Calgary to build affordable housing. And we hope the leaders at the time needed will step up and commit to the capital needs. And this brings me to the most recent news. The news about risk and seniors. An elephant in the room, which is the fire in Quebec. That fire tragically killed 28 parents, grandparents, aunts, uncles, friends, people who had given their lives to build the Canadian society, to be a part of the fabric. People who deserve better. I can tell you, though, without a moment's hesitation, every manager in every seniors facility in every city fears that happening. The truth is, though, in Alberta, most affordable housing for seniors that's been built was built 30 to 50 years ago. When they are old buildings, they are wood frame, And because the challenging truth is there's no good way to evacuate 85 to 100-year-olds. We saw that in the June floods, trying to get 600 people out of our buildings. The act of even conducting a fire drill is dangerous. Many seniors have some level of dementia. They'd be confused even how to get out of the building without one-on-one support. Most have some physical disability and wouldn't be able to navigate to the exit without support. Many take medications to sleep and need to be roused one by one to get out of their beds during a fire. I remind you that most affordable housing built in the 50s, when a senior meant the ripe old age of 55. Not 105, not 85. Those same buildings that were built 30 to 50 years ago have not changed because of lack of funding for seniors, because of the reality of seniors are the low budget priority, even though we have a cliff. The tragedy in Quebec is awful. What I don't think people realize is that that tragedy impacts the quality of life for seniors in our communities today, not unlike watching 911 reel over and over and over and over again. That stress impacts their health, and higher anxiety comes higher incontinence, sleep deprivation, disorientation, eating issues, depression, higher medications, and a tremendous amount of pressure on staff to meet that new reality, and a higher cost to our organization. Senior safety, their happiness, their quality of life, that's what keeps me awake at night. Beyond the new buildings we need to build in our future, for sure, today we have seniors outliving their family, outliving supports, or having limited supports, communities where they're disengaged, and they have a risk of a lower quality of life than you and I. Not-for-profits like Silvera, we offer the basics. But when you serve a low-income population, there aren't the dollars left over to invest in services, to advance programs, to improve the quality of life. I hear stories every day and I witness it every day. Seniors who can't get out in this Calgary weather without some kind of help. They can't afford a bus pass or a taxi. They're still waiting inside for something to happen, yearning for a more meaningful life, beyond waiting for their 3 meals. Perhaps a visit, an opportunity to learn a new instrument, perhaps use a computer, learn how to Skype. We could create those opportunities for a fuller, more engaged life with support. With support, they could have a purpose to get out of bed. Many residents, when you have limited income, you have to make some tough choices between the basics, like my incontinence products, like my medications, or the extras, perhaps the outing, the new shirt. Basics always win out. Increasing Calgary's attention today, increasing donors' investments, that would allow us to increase the kind of opportunities we can provide for seniors in our community to have a more meaningful life. I'm going to share a couple of stories that are real stories of people who are in our communities. Like Jack. Jack was one of the residents that said to me he'd love to tinker with a car. Always wanted to tinker with a car. He wanted to learn fly fishing. He had no family. He was challenged his entire life with severe dyslexia. He was always alone, always in low-paying jobs where he couldn't afford a car, thus his dream to tinker. He said to me, Arlene, living waiting to die kills your soul. Jack passed away, never tinkering with that car. Or our resident in Bow Valley Lodge, in that community, who never participated in any of the activities that we held in the community, only for us to find out that he had tremendous hearing loss and needed funding to get hearing aids. Well, now he joins in all the sing-alongs. Or the gentleman in our Valley View community who ran out of incontinence products by the third week of every month. That's why his chair was consistently being soiled that last week of the month. We cannot continue to turn a blind eye on the isolation, the loneliness, the need that's the reality today for seniors living in our communities. Calgary is a great city, and as is often said, when it's great for everyone. For that to happen, we need to shed a light on seniors. They are not the disposable population. So, as the movers and shakers in this room, how can you help? Yes, money matters. First, though, I'd ask you to leave this room and rethink the laundry list of the things that you give to, that you're passionate about, and let's all get our heads out of the sand and start to think about readying the world for low-income seniors who need supports, need affordable housing. Let's put them on that agenda. Let's make it a cause that we invest in. For those of you who have a job, or perhaps you're leading your company, put the seniors' issues in your corporate social mandate. I can't tell you how many corporations we've met and seniors aren't part of the mandate. Build employee engagement where they come out and do something special for seniors. Make seniors a priority. Be an advocate, be a voice for seniors in our city. Don't just assume they're happy living in that building and they're getting all that they need to get. Do you ever see them? Advocate for government change. Seniors today need you and I to take the lead. They need you and I. Right now, they're waiting for change, hoping for change, and sadly, they're living on memories of 20, 30, 40 years ago instead of memories of just yesterday being their best day. That's not good enough. I think it's the decent and humane thing to do to make this vulnerable population a priority. Let's face it, you and I, we're going to be there in 5 minutes. Remember, it was a small group of socially minded Calgarians, probably some Rotarians, who stepped forward to care for low-income seniors 50 years ago. It's time, it's over time, to pick up the torch and carry this work forward. Thank you.